Good morning. My name is Breanne Haller. I'll be the nurse practitioner student with you today. What's your name?
My name's Jesse Haller.
Jesse. What brings you into the clinic today?
I hurt my foot and I have some pain in it.
Okay. When did this start?
A couple days ago.
And what were you doing when it started?
I was hiking in the mountains. We were snowshoeing and I fell in a hole.
Okay. When you fell, which direction did your foot fall or go?
I'm
Do you remember?
not really sure. I just kind of fell in it and then it twisted between some rocks.
Okay. Did any rocks fall on top of your foot at the time?
No.
Oh, okay.
Snow.
And which ankle was it?
My right ankle.
Okay.
Here.
All right. Do you have any pain in your foot or your leg other than that ankle area?
Just some blisters, but mostly my ankle.
Okay. Did you take any medication for it?
I took some ibuprofen.
And did that help?
I think so.
Okay. I do see some swelling. Have you noticed any changes in the swelling?
No, not really.
Not so much. At the time of injury, did you use any ice or heat or wrap or anything like that?
There's a lot of snow, but other than that, I didn't put anything on it.
Nothing specifically? Okay. And have you seen any other providers for this?
No.
All right. So you said it started about 2 days ago when you fell while you were snowshoeing. Used some ibuprofen, helped a little bit. Right now, on a scale from 1 to 10, what would you rate your pain? 10 being the worst pain in your life.
A 3.
A 3? Okay. Have you had this happen to you before? Yes?
On multiple occasions.
Have you broken either one of those ankles?
No.
Okay. Have you broken any bones?
No.
All right. So we'll kind of go through your past medical history then.
Okay.
We'll start with your head. Have you had any issues with your eyes in the past?
Just, I burned them one time and I lost my vision for a week.
Okay, that's pretty severe.
Yep, but I went to the VA and they told me that they had healed.
It's all back to normal now?
I think so.
Okay.
I see well now.
All right. Any issues with your nose or sinuses?
No, not that I'm aware of.
Okay. And how about with your ears?
They work pretty well, I think.
No hearing loss or issues with infections?
I've had some hearing loss probably from some time in the military, but
okay.
Other than that, I think normal stuff.
All right, understandable. Any issues with your mouth or your teeth?
No.
Have you had your wisdom teeth out?
No, they told me that I should when I was in the military, and then I didn't do it.
Okay.
But they haven't bothered me. That was like 8 years ago.
Okay. All right. So we'll keep moving down. Any issues with your skin or skin diseases in the past?
No.
Okay. How about your lungs? Any issues with asthma as a child or now?
Nope.
Any other infections in your lungs in the past or issues that way? Okay. Never have shortness of breath or difficulty that way?
Only if I'm hiking.
Okay. How about with your heart? Any issues with your heart in the past?
I don't think so.
Or with your blood, any bleeding disorders, anything like that?
Mm-mm.
Okay. How about issues with, do you have diabetes or any other issues that way?
No, not that I'm aware of.
Any problems with eating or pain with eating or after eating?
I'm pretty good at eating, I think. No pain.
Okay. And then with your bowels or with your intestines, any problems that way?
It's all good, I think.
All right. And then let's keep moving down. You said no issues with your bones. How about your kidneys? Any problems urinating or any issues ever in the past that way?
Nope.
Okay. And for surgeries, have you had any surgeries at all?
I had my eyes cut with LASIK surgery.
You did have LASIK, okay.
Yep.
Before or after you had the injury to your eyes?
That was before.
Okay.
It was maybe 7 years ago.
Okay. Right. And then, I guess, have you had any moles cut out or any skin surgeries?
I had a mole removed once. I think I was in middle school.
Okay.
And I burned it off, I think.
Okay. No issues afterwards? It was benign, most likely then? You said you haven't had any skin disease?
No. There was no disease. They just wanted to remove it because it was a big mole.
Sure. All right. So we'll move into family history now. Are both of your parents still alive?
Yep.
Okay. Do either one of them have any significant health issues that you're aware of?
Not that I'm aware of.
Okay. And now how about for your grandparents? Are all 4 of your grandparents alive?
No. My both grandfathers have passed away.
Okay. And how did that happen?
One of them had a heart attack, and I think he had 3 of them, but he smoked and drank quite a bit.
Okay.
And then the other one, I think he had a congenital heart disease of some sort where he had a hole in his heart, and they were both in their 60s or something though.
Okay. So neither of them had an early death.
Nope.
Both of them had some heart issues. One of them had some alcohol and drug abuse.
Not drugs, just smoking.
Just smoking, okay. Do you have any sisters or brothers?
Yep, I have one sister and one brother.
Okay, and do they have any significant health issues that you're aware of?
Not that I'm aware of.
Okay. Do you have any children?
Nope.
All right. We'll move on to social history. Do you drink alcohol?
Yep.
Okay. How many days a week would you say you drink alcohol?
Probably 3 or 4.
Okay. And then on those specific days, how many drinks would you say, or how many beers or how many glasses of wine?
Probably 1 glass of wine twice a week, and then once a week maybe a mixed drink or 2.
Okay. Do you smoke cigarettes or cigars?
No.
Any tobacco products? How about any chew?
No.
Okay. Do you do any illicit drugs or street drugs?
No.
Okay. And then do you exercise at all?
Yes.
How often would you say you exercise?
I try to most days, probably 5 or 6 days a week on average.
Okay, that's great. And what do you do for exercise?
Either weightlifting or the treadmill or outside if it's nice.
All right. Thank you so much. That concludes this part of the assessment.
Thank you.